People who are out there and having lots of recurrent respiratory infections may not realize it, but the kind of doctor that they really need to see is an allergist immunologist. Because when a person's having recurrent sinus infections, there could be 3 major reasons why they might be having them. 25% of people in America have some form of allergy, and a lot of those people get recurrent sinus infections.
Prior to coming to Dr. Baxter, I tried several other things, but really I was doing self-medication, just pretty much living with what I was having to put up with, thinking this is just the way it is and I just have to deal with it.
What basically happens is that the membranes inside the nose become so swollen from infections that secretions are trapped there and infections can't drain, and the area just stays chronically infected.
What I was doing was I was alternating between Dr. Baxter and the ear, nose, and throat doctor to get my antibiotic.
His allergies were causing the frequent infections that he was having, and he's really not having those anymore now that he's taking his shots, and his shots have been able to be built up to a high dose.
And so Dr. Baxter took the approach of let's fix the problem instead of masking over the result.
25% of people in America have some form of allergy, and a lot of those people get recurrent sinus infections. 10% of people in America have chronic sinus disease based on a structural issue, meaning their anatomy requires a fix by a surgeon. And then about 1% of people in this country have an immunology reason why they are having recurrent infections. And so basically people, when they're having chronic infections, if they're not sure which doctor to go to, they really should think about going to their local allergist or immunologist.
Dr. Baxter helped solve the problem by getting to the root of the problem. I recommend to my friends all the time, I say, you know, if you have a cold or an allergy or something, go see Dr. Baxter. She helped me get over my particular problem.